Hello and welcome. Today we're diving deep into a fascinating yet potentially sight-threatening eye condition called Climatic Droplet Keratopathy, also known as Decoder keratopathy, spheroidal degeneration, or Bietti's nodular dystrophy. Join us as we unravel its mysteries, from its causes to its treatments, and everything in between. The exact cause of climatic droplet keratopathy remains somewhat elusive, but the primary culprit is long-term exposure to ultraviolet, or UV radiation, specifically UVB rays. This is why it's most commonly seen in people who live near the equator or at high altitudes, where UV exposure is intense. Contributing factors might include chronic wind and dust exposure, drying conditions, and perhaps even genetic predispositions in some cases. It's like the sun's rays are slowly cooking the cornea over years of relentless exposure. At the microscopic level, climatic droplet keratopathy involves the deposition of abnormal proteinaceous material in the cornea, specifically in the Bowman's layer and anterior stroma. This material is thought to be derived from damaged keratocytes, the cells responsible for maintaining the corneal structure. UV radiation triggers these cells to produce and deposit these abnormal proteins, which then aggregate into the characteristic droplets we see. Over time, these droplets accumulate, disrupting the smooth surface of the cornea and leading to vision problems. Climatic droplet keratopathy is more prevalent in regions with high UV radiation, such as countries near the equator, mountainous regions, and areas with significant outdoor working populations. The condition is also more common in older adults, particularly those with a history of extensive outdoor activities without adequate eye protection. Certain populations, like those in Labrador, Canada, and specific groups in Africa and Australia, have shown a higher incidence, likely due to a combination of environmental and genetic factors. Men are often affected more frequently than women, perhaps due to greater occupational exposure to sunlight. The signs and symptoms of climatic keratopathy can vary depending on the severity of the condition. In early stages, you might experience mild foreign body sensation, dry eye, or blurry vision, especially in bright light. As the disease progresses, the droplets become visible as small, yellowish-brown nodules or opacities on the cornea. These deposits can cause significant glare, photophobia, sensitivity to light, reduced visual acuity, and even a gritty feeling in the eyes. In advanced cases, the corneal surface can become irregular and scarred, leading to significant vision impairment. Diagnosing climatic droplet keratopathy typically involves a comprehensive eye examination by an ophthalmologist or optometrist. A slit lamp examination, which uses a high-intensity light source to examine the cornea in detail, is crucial for visualizing the characteristic droplets. Corneal topography can also be used to assess the irregularity of the corneal surface. In some cases, corneal biopsy may be performed to confirm the diagnosis and rule out other conditions. The slit lamp allows your doctor to see the telltale signs of the disease that would go unmissed by the naked eye. While climatic droplet keratopathy doesn't have strict classifications or types in the same way as some other corneal dystrophies, the disease's severity is generally graded based on the extent and density of the deposits. We might describe cases as mild, moderate, or severe, depending on how much the deposits affect the patient's vision and corneal structure. Factors like the patient's symptoms, age, and overall health are also considered when planning management strategies. Treatment for climatic droplet keratopathy aims to alleviate symptoms, improve vision, and prevent further progression. In early stages, lubricating eye drops and sunglasses are often sufficient. As the disease progresses, superficial keratectomy, a procedure to remove the surface deposits, may be necessary. Phototherapeutic keratectomy, or PTK using an excimer laser, is another option for removing superficial corneal opacities. In severe cases, when vision is significantly impaired, a corneal transplant may be required to restore sight. Regardless of the chosen treatment, ongoing monitoring is essential to manage potential complications and recurrence. Prevention is key when it comes to climatic droplet keratopathy. The most effective way to protect yourself is by wearing sunglasses that block 100% of UVA and whenever you're outdoors, even on cloudy days. A wide-brimmed hat can also provide additional protection. If you work outdoors or spend a lot of time in sunny environments, consider wearing wraparound sunglasses to minimize UV exposure from the sides. Starting these protective habits early in life can significantly reduce your risk of developing this condition later on. The prognosis for climatic droplet keratopathy varies, depending on the severity of the condition and the effectiveness of treatment. With early diagnosis and appropriate management, many people can maintain good vision and prevent significant vision loss. However, recurrence is possible even after treatment, so regular follow-up appointments with an eye care professional are crucial. Ongoing research is focused on developing new and improved treatments for corneal dystrophies, including climatic droplet keratopathy. For example, studies are exploring the use of antioxidants and other medications to reduce corneal damage caused by UV radiation. Furthermore, advancements in corneal transplant techniques, such as lamellar keratoplasty, are offering more precise and less invasive options for restoring vision in severe cases. Staying informed and proactive about your eye health is the best way to navigate this condition.